Hey, Mulavinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Navilati. A big Vinaka Vakalevu to all of those that have been following our Facebook page and have been supporting our content right here on Oceania Hospitals, and especially our YouTube channel, Vinaka Vakalevu. Today with us in studio, we've got none other than a GP here at Oceania Hospitals, General Practitioner, Dr. Sylvia. Mulavinaka, Doc, welcome to the show. How are you?
I'm fine, thank you.
Just before we start, right, could you just tell us a bit about your journey, just about yourself, and that eventually led you here to Oceania Hospitals?
Okay, so I basically graduated from Oman Prasad School of Medicine, which is located in the University of Fiji in S1E9. I did internship in CWM around 2018, and I became a medical officer in 2019. So that's when I was in the public health sector, and I've worked in Paralebu Health Center and Samambula Health Center. And then for a brief moment, I was a forensics pathologist in the Fiji Police Force, and since last year, I've joined Oceania Hospitals.
Thank you very much for that. It's quite impressive and it's quite an interesting journey. Could you just tell us, we've got a lot of the younger viewers watching already. We're going to digress a little bit here. Do you have any advice or tips for our younger viewers that's pursuing a career in this field?
I guess the only thing I would say is not limit yourself. If you feel like you are someone who's not academically capable, there's a lot of things that you can pursue. There's a lot of things, like you don't really have to have a good English or anything like that needs to be written. You can always use your skills and assets to pursue any sort of career out there.
Thank you. You're a general practitioner here at Oceania Hospital, and of course, there's always a lot of patients coming in on a daily basis, and it's always busy. Could you just tell us, could you just share with us some of the challenges that you've probably faced here?
The challenges. Okay. One of the challenges on coming into Oceania from all the parts of the world. So we've got a lot of people from different countries, and when they come here, sometimes they do not understand English, and that can be a bit of a struggle for us, because as a general practitioner, we need to get into the tiny bits of the illness. We have a lot of information that we need to diagnose you, and that can be a challenge, not getting a proper history.
Thank you very much for that. Dengue is on the rise, Could you just tell us a bit about the cases that you've probably have seen throughout the past few weeks, and do you have any advice in terms of proactive measures or preventative measures for our viewers?
Okay, so dengue is basically a viral illness. There are no antibiotics to treat it. It doesn't have a set medication that can treat it. So dengue is basically spread from mosquito bites. And the way to prevent dengue is to get rid of the mosquito bites, and it can be a bit of a challenging thing. So the main thing you would do is try to see your surrounding, try to clear it of rubbish and debris that can be the breeding grounds for mosquitoes. Try to use mosquito repellents. Try to sleep with a mosquito net on if you feel that you might be exposed to a lot of mosquitoes. And yeah, the usual mosquito coils and stuff.
Thank you, Doc. Just before we wrap up, do you have any advice or tips for our viewers, especially in terms of maintaining their general health?
Okay. Is it in regards to dengue or?
It could be anything.
Okay. So basically, we've had a lot of patients coming in with obesity, and this obesity starts from childhood. There's a lot of cases of children coming in with obesity because of readily available fast foods, and with the current situation where both parents are working, lifestyles getting really busy, we tend to opt for things that are easy and fast. And we tend to just not focus on the healthy aspect of life. With this said, because of lack of time, a lot of people don't engage in physical activity. And so these are the contributing factors for obesity. When it starts in childhood, it carries forward through your life. And that is why we have a lot of premature deaths happening in Fiji. And these are all preventable. If we try to focus on our little ones and our health while we are young, we can prevent all these complications that we have from other illnesses like diabetes, hypertension, and even having heart attacks at a very early age.
Thank you very much, Doc. Well, there you have it, ladies and gentlemen. And, just before we go, I'd like to announce that we've got specials on dengue and leptospirosis test here at Oceania Hospitals, and they'll be up right here on our Facebook page and all our social media accounts. So, until next week, thank you very much.